All right, guys, good morning. Welcome back to the pod at Tomboy Official. I'm. I think I might have had a cold or something. I mean, I don't think colds usually last just one day, but I know I did mention on Tuesday sometime, feeling like had like my throat was a little dry. And on Wednesday, I kind of felt something coming on, but it's not my normal cold and flu symptoms. Like, usually when I'm catching a cold, it is from my. Usually, I get my sinuses, usually it's, sinuses draining. Um, and usually I'll have like maybe 1 or 2 days of like low energy right before. And then, yeah, my sinuses are draining and it just gets worse and worse. And then that usually leads to like coughing. And that's usually how it always is. But this was different. And it's happened a few times. Not so much lately, but it's happened a few times where it's like it feels almost like it's gonna be a cold, but it's more in my chest than in my like nasal passages. And it's kind of like a dry cough and like occasional like I don't know if I would call it like phlegm, but like just occasionally, like I'll have like a cough. It's more of like a little respiratory thing at the upper part of my like lungs, pretty much. Um, and then there's a little bit of impact on like my sinuses, a little bit, but not so much in the nasal area, more so like near my throat, like the sides of my throat. So I don't know if that's some kind of allergy. I have no idea. It seems to be something that I can kind of sleep off for like a day or two. It might be stress related. I really don't know. It's something that's kind of happened maybe in the last 3 years or so on rare occasions, just kind of off and on. And it lasts maybe 1 to 2 days. It doesn't seem to like peak into some kind of other cold or flu. And I don't know if like colds and flus have like levels of like severity to them as far as like can you really get a cold that lasts like 24 hours? Like usually my colds last me like a week, but I was able to rest and I kind of talked about it yesterday a little bit, but I felt a lot better after resting. Like I ordered some pho for lunch. Um I didn't eat breakfast at all. I just kind of lounged around. I don't think I hydrated properly. I feel like I drank like 2 water bottles, maybe three max, which is not a lot. I had a bowl of pho. I had, um, I don't know. I think for at like 5 o'clock, I had I had those leftover organic canned raviolis by Annie's and added some black pepper and some of the chicken from Sprouts. It was like a thigh part of the chicken from Sprouts, and I just ate that with it. Um, and then I didn't really have dinner. I mean, that was dinner, but I guess I just had like some Ritz around like 9 p.m. A little snacking. Um, took some melatonin around that time. I took maybe I think it was like 7.5 milligrams or so. My throat's not perfect. Like if I were gonna try to sing or something, that would not go well. I mean, I'm not like the best singer, but it would be worse than usual. Um, and like I can talk, but it's like I do feel a little bit of raspiness in my throat. It's not just because it's a morning thing. So, anyways, that's kind of what's going on with that. I really don't know if it's some stress related thing or some other kind of thing. Um, Luckily today, when I've been having some caffeine, it's um it's been helping, but I've had a lot of it so far. Um I'm back with the can of yerba mate. I put it in a water bottle, like an empty water bottle, so I can tell how much I'm drinking. So I've drank like more than half of a can's worth already today. I do feel the energy kicked up though, so that's good. The day before, I feel like my energy on Tuesday just never really got where I needed it to be, and even though I had a lot of caffeine and even a lot of C4, um, I think the coming down from that, like all that caffeine, like Tuesday night, I was a little overwhelmed and stressed out just because of that caffeine crash there. Uh, you're really not supposed to have C4 on the same day that you're having other caffeinated beverages, but sometimes I'm like, well, if the other caffeine never really fully kicked in, then I don't really feel like that off about it. And yesterday I was trying to be ambitious, so around 3:30, I decided, okay, I'm gonna get up around 5 because I just lounged around all day. I like forced myself to lounge around. I was like, I'm gonna get up around 5, so I'm gonna have some C4, and I'm gonna start working out around 5. I did like minimal amount of stretching at like 5 o'clock, and I my energy never really perked up, so I just laid back down. And that's when I ate that meal too. So I don't know, like it just wasn't happening yesterday. It wasn't gonna happen. But I do feel better. I think I just needed some more rest. Like my sleep has been off um a little bit, and it's probably because of the caffeine. So, and I do wake up early. Like even today I woke up around like 5, let's call it 5:15, 5 around 5 a.m., 5:15ish, somewhere around there. Um but it's hard to tell what time it is. Like sometimes I'm like, is it 2 a.m.? Is it 3 a.m.? Is it midnight? Like what time is it? I feel like I went to bed. I fell asleep probably before 11. I don't remember seeing 11 p.m. Um, so I think I fell asleep before that, and I don't remember if I woke up because I know I was falling asleep before 10, and then I waited a while to take a restroom break, but I can't remember how many restroom breaks I took last night. If it was just that one, I don't know. Because I know when I woke up, I did again, and it was like 5 something in the morning, but I didn't look at my clock. I was like, I don't know what time it is. I just noticed that the heater had turned on because I'd had it set to 70, and I guess I never turned it fully off. And so when the heater came on, I was like, oh, it must be like 5 a.m. or so because or 4 something because that's about the time that the heater comes on because it gets freaking cold um in this house. So um I think having to relax yesterday was probably one of the hardest things I had to do. um I didn't want to relax. I wanted to power through and get some work done. um I wanted to study yesterday. I probably went through like half of one set of quiz questions, and that really wasn't a lot. um I couldn't even focus. I tried to like try to find something to focus on or whatever, and I was like, I can't even focus enough to like actually do it. So that wasn't gonna work. um so yeah, since I couldn't really focus, I just kind of left it alone. Um it's just not pleasant. It's not um I don't like having this weird kind of issue with like focusing and my energy being all over the place. Um, like you know, because it's kind of easier to be on like a a predictable schedule. Like mornings, I think if I have enough caffeine, I'll usually be good. Um, but I really don't know. Like, so I'll see what I get into today. I think I'm mostly, um, I've got studying to do. I've got an exam to take pretty soon. Um, I gotta take the practice exam. I really don't want to take it. It's just I've got a lot of stuff to do today. I've got an appointment today. I've got an appointment Friday morning. And the appointment Friday morning is probably gonna take me about an hour to get over there. Um, I so let me see. That's Friday. Saturday. I mean, I've got stuff to do Saturday. I'll probably be at the gym some maybe because I need to work out. Like I got in that one gym day this week, and I feel like it wasn't that good. like it Tuesday at the gym wasn't that good. It was better than nothing. I'm glad I got up and went and did it, but it wasn't that good of a workout. But I was sore. Like I was feeling it Wednesday. Like I don't think you have to be sore just to be making any kind of progress. But I was like, well, at least I did do something because like I felt it. Um, but I don't really know. It was kind of like my energy wasn't behind it as much on Tuesday. So, um, that's just kind of how it is sometimes. And so yeah, today I've got some plans of things I'm gonna be getting done. I I think yesterday I watched that movie Travis about Travis Kalanick. Um, that movie about like Super Pumped or whatever on Netflix. About the story of Uber for the most part. Interesting story. Um, I'm not gonna do a spoiler on here, but I mean that kind of stuff is up my alley. I really liked the Social Network. I kind of like hearing about different millennials and how they've kind of paved their way through having making these digital companies basically um, that have really changed you know they've really changed a lot of the old school things. um, I do find it interesting that you know I don't know, like maybe there were people maybe even a little bit before, like I would say like Bill Gates, Steve Jobs, um were kind of younger company owners too, but it's like I feel like before that you mostly heard about like old people who were like in charge of companies, and then when you find like younger people, that was kind of like later on down the road, like in the millennial generation, with computers and computers being in households. I mean that was kind of the first thing I thought. I remember my dad, he's kind of a splurger with stuff, and he used to always buy computers. Like he was the one who was into computers. When I was a kid, we had, like, when I was really a young kid, we had this I don't know what it was. It was like a black and orange screen that had like those floppy disks, like those black thin floppy disks. Um and then we always had computers in school, but again, we used to have to save things on those little hard disks. And that was before like flash drives and stuff. But our school always had kind of like older equipment, but then they kind of caught up later on. But it was enough to like learn. Like you could learn word processing, learn typing, learn how to use like, you know, computer software and stuff, and like use the little manuals to like do your assignments and everything. Um, I always kind of had trouble with the formatting. It was always like really weird. Uh, but I don't know. I had trouble with a lot of things in school. I was more of a self learner. Like I don't think the school that I mostly went to school at till like 10th grade, I don't think it was a good environment for me to learn. Like, because there were classes, they always doubled up the classes. So it would be like fifth and sixth, seventh and eighth, like third and fourth, you know, nine and 10. And you'd be in the classroom together. So the teacher was almost always talking, or people were always like answering questions. And there was always some interaction going on with the teacher and other students when your portion of the class was supposed to be working on some kind of assignment. So for me, it was always too much background noise. There was too much going on. It was like overstimulating. I couldn't think or focus. So most of the work I had to do in class, I hardly ever got it done. And so a lot of times I was taking my work home and just doing it at home. I almost never learned anything in class too much. I mean, I'd listen to the lectures and stuff, and then, you know, the classwork and all that, like homework and all that, I'd usually just have to take it home and do it. And I did that probably since between third grade and 10th grade. So probably like 8 years of school. I did that till I went to my last 2 years of public school. But yeah, you know, I definitely learned better. Just give me a book and put me in a room by myself and I'll learn it. But, you know, I feel like sometimes school was a little too scattered for me, like having all these different topics that you're learning and nothing really overlapped earlier on, you know, with like generals in college and all that. And I was like, why are we learning all this like random stuff? Grad school worked better for me because it was like very focused on like one thing. It's like I'm learning psychology. Well, it's more like statistics and applied to psychology, and that's all I would do. Like every class would have something related to statistics, something related to presentation, something related to lit reviews. Um, you know, even the textbooks we were reading were about research studies and things, and then the professors were researchers and, you know, professors and writers, and, you know, that was basically the environment I was in. It was, you know, that worked for me. I was like, okay, like this makes more sense because we're doing like the same thing, just like with a different topic focus of every class, but like I could kind of see kind of the overlap with everything versus before it's just like we're just learning all these random subjects just so we can say that we learned them basically, and nobody remembers all that stuff. You kind of remember what you like and what you kind of have an interest in, or maybe something that you had like a pretty impacting project or something on, but you don't usually just like remember all of it. Like a lot of that information is like you learn it just to learn it because that's what you do. Um, but it is kind of just a weird. It's kind of just a weird way of, you know, that schools really expect people to kind of do things one way. And when I look back, I'm like, there was so much that, you know, people just overlooked with me, that they like the teachers in my life and stuff, just they weren't very well trained to kind of like catch certain stuff. Um, they kind of like recognize certain things. Uh, like I recognized, like I was like, I do not learn like all these other students, and I am, you know, I didn't feel like I was like, uh, you know, um, like I don't know. Like I thought that I always felt like I was smart, but it was always with stuff that like nobody else cared about. You know, like my school didn't like value things that weren't religion and things like that. I mean, I was really smart with like religious topics, but I think I questioned things too much, and they didn't like that. They didn't like that I would like pose questions. Uh, they're like, oh, well, you learned the information and it's from the Bible and it's based on the tradition of this church, but they didn't like it if I put another spin on it and be like, let's actually talk about this. They didn't like that part. Um, and so, and that's just kind of how my mind works. I don't just like take in information and be like, oh, this must be right. It's like, nah. I mean, there are other people all over the world that believe so many other things. So what makes this more right than all the others? I mean, there are religions that are older than that religion. There are cultures that, were around at those times where, other people say that they have some god that made them, or some other creator who made them. It's like at the beginning of time. So it's like, whatever. Like, I don't really care. It's like people can believe what they believe, they can think what they want to think. I don't really think it matters all that much. I think what matters is really how people treat each other. Um, there's really no point to all the like arguing and like nonsense that comes with it. Um, I feel like once people kind of like realize that they're in a disagreement, it's like people don't really have to see things the same way. I would say where I feel a little differently is when it comes to um, people. I don't want to call it just like straight up taking advantage, but where I feel a little bit differently is where when people yeah, kind of take advantage or manipulate others, or take advantage of their power position to kind of treat people however they want, usually in a negative way. When they use it in a negative way and they're trying to like use their demons against other people, like that kind of stuff. You see that a lot in the corporate world. You see that a lot in like higher education, and there's stuff like that that just really turns me off. Um, I mean, people do say about psychology, that like a lot of people go into psychology because they have issues. Um, and it's kind of a weird, stupid way of saying things. It's kind of like, who doesn't have problems, and who has never had any kind of psychological issue. I highly doubt that there are many people who could have never used any kind of psychiatric treatment or psychological kind of therapeutic kind of intervention, even if it's not like a Western based one, talking to some kind of healer or something. Like, I feel like a lot of people need some kind of support eventually in their life, or could have used it even if they don't use it, or if they don't have it available. So it's kind of hard to be like, oh, like people have problems. I think it's just like a dig at people who are in psychology, because people are so weirded out about the field and so uncomfortable with it that they kind of want to make it. There's still that stigma attached to it. So I do kind of get that. I think that's where it comes from. Like, people are uncomfortable with people going into therapy or whatever. Um, so they kind of try to knock it. But what I've noticed in the field, unfortunately, is like, and I'm not the only one who notices this, you'll come across professors, supervisors, leads, um, you know, uh, bosses, owners of clinics and things, uh, people like uh, in the higher up offices and stuff. A lot of people in those positions have a lot of issues. Not every person. I've definitely had a lot of staff that I worked with that the majority of them were really good, but it doesn't take that many. You only have to have one bad supervisor to make the clinic a terrible place, or one bad psychiatrist is like screwing up everything with everybody's clients, and then like you're the therapist who has to hear about this doctor from like all these clients who are seeing them. And it's like, you got to take that kind of stuff seriously. And it's like, you know when you're a student, or when you're starting out in the field and you're pretty swamped with other stuff, it's hard to really realize, hey, this isn't good. This isn't how it's supposed to be. You're not supposed to have these like wackadoo people like trying to like run your life and stuff. But a lot of times it's hard to see. But now when I look back, I'm like, oh my gosh, like, all there are so many people that I came across in higher up positions that were just not well. They were just not well. And I wasn't the only one who thought that way. Like there were people that I've been around who kind of jokingly called it out, like in a lunchroom one day, and everybody was saying, you know, they would ask everyone who came in, "Hey, did you have a problem with this person?" And that person was like sitting right there, and that person was trying to call out, like, "Hey, like I was kind of fearful of you when I first met you," and I could tell that they were asking everybody, and I was like, when I came into the room, they asked me too, and I was like, "Oh shoot." And so I just kind of spoke my piece about it. And I'm like, well, if you're going to ask me, I'm going to answer. And like, I gave an answer that people didn't, I guess that person didn't really want to hear. And, you know, people just, you know, everyone's kind of going through things, but I feel like in some fields, and it's the workload too. It's like people don't know how to manage their stress levels. Um, but yeah, there are a lot of these people who are in these management positions that really are doing a lot of harm to their staff, and the staff will just deal with it because they're like, well, I need this placement so I can move on in my career, and so they'll just put up with it. But it's not okay. Like I can't tell you how many students I know or friends that I know who either have like a PsyD or a PhD. Most of my friends have masters and are licensed therapists. Some of them have private practices. Some of them work for group practices. Some of them are doing their own side things. And almost all of them have had, you know, at least a few, bad apple kind of uh, people in higher positions who were like overlooking their work and stuff. And it's just kind of weird. It's like, and those people end up in leadership roles. And it's like, they're just bad. Like, there's so many bad ones. I mean, it's not like everyone's bad, but, I think it doesn't help though, because, like, when you look at the state of, the people in society that are needing help, there's a lot of people who are like me who would love to do the work, would love to help others. And, but you got to pay me to do it. You can't just, living in LA, a person with a master's, they want to pay you like $24 an hour. I could manage a McDonald's. I could be a manager at a McDonald's and make more than $20 an hour. I could probably start working at McDonald's just on the burgers or on the drive-through or whatever, probably making $20 an hour. It's like, come on, guys. You know, um, and I know if you're licensed, it's different, but it's like I have a lot of friends that are licensed that are still struggling to find a good placement, a good fit. There are a lot of these clinics and companies that just aren't a good fit. And, I work with a lot of level headed people. I mean, I know a lot of level headed people that I've worked with that are friends of mine that we no longer work in the same place. And I know their work ethic. I know that they're good at what they do, that they care about the clients. All the people that I'm in touch with are really good workers. They're really professional. They're really good with the clients. Nobody's, had any kind of weird, like, inappropriateness with clients or other staff. Like, they're all really good people, and they really try hard and work really hard. And there's so many of them that are just, not happy with their roles at work, or not happy with, like, the status of things in these mental health clinics. And, if you have workers that are all saying these things, and then there's these companies that just really don't, the higher ups don't want to work with you. I've talked to these people before. I've had meetings sitting down talking to these people, and they will gaslight you. They will sit and act like they don't even know what you're talking about. Like, one of the meetings that I remember having is because we were concerned as staff that we had to keep taking on more and more high risk clients to the level that we weren't able to serve our regular clients who weren't high risk. And so they ended up going to crisis houses and hospitals because they weren't getting the treatment that they needed. And a lot of them would say that they were in crisis just so they could get the help. And I mean, I'm not saying don't do that. I mean, if you got to get your foot in the door, do whatever you got to do before it gets bad. But it's like, it's not fair. It's not fair that we had to keep canceling groups and canceling sessions with certain people who made their way to come all the way into the clinic. But no, Like now I have these high risk clients and they happen to keep calling, and I have too many of them, so I can't even keep my other appointments because I've got all these other people on the phone in crisis all the time. And it's like I can't do both, like you got to have like a max at a certain level. There's got to be some structure. And when we brought up this issue of how many high risk clients we're adding every week while we're not taking some of them off the list because of the rules of having to keep them on for 30 days. But then if you're adding like four every week, and then they said that we would max out at 10 to 15, and then we were getting over 20 at a certain point, and we were like, this isn't okay. So we started speaking up about it, saying we can't keep doing this. And then they were like, but you have to, because we have to let them come in. We have to admit them. And we're like, but we can't work with them because it's not good quality for the rest of the clients, and we had to keep taking it higher up. And we wrote this letter, and the letter went higher up past our management that was in our building, past our director that was in our building, up to like the offices. And they came in and had a meeting with us, and those people just, they're like, oh, well, why don't you make a plan? I remember that they were like, they're just oblivious to how things work. It's like, this is a walk-in clinic where anyone in a crisis who, you don't even have to have insurance, you can walk in off the street in a mental health crisis and you'll be at least screened. This was the site. And people these higher ups did not see it. They were like, oh, well, why don't you schedule time, an hour at the beginning and an hour at the end of the day, to take these calls or to do this or to do that. And it's like, that's not how this works. You can't schedule a crisis call. You can't schedule, like, what are you going to call them back? Oh, I'll wait till tomorrow at 9 o'clock. I'll call you back in the morning. Like, no, you got to take the calls when they come in. When the person walks in the door, you have to cancel whatever you were doing because this person needs priority treatment over the people who are already scheduled. Supposedly, like, we don't really know, but that's what we assume because they come in stating, I'm in crisis now, so I have to be seen. And so we would prioritize them and they would have to be seen. I mean, I'm not blaming the clients, but I'm like, there was no solution. They didn't make a solution. It was basically our manager who came back, or director who came back, who had to like create some kind of a solution process of getting these people off the list before a 30-day period. But then they never stopped the process of enrolling new ones. Basically what was happening is more and more people were coming out of drug rehabs, and because those people were considered high risk because they were in an inpatient treatment, we had to keep them on the high risk list for 30 days. Now, our clinic was not a substance clinic. So once we had these people on our list that were primary substance, we would notice that they were primary substance, not primary psychiatric. They were primary substance. And we weren't supposed to have primary substance. That goes to the substance treatment programs. But they would kind of bend and twist the diagnosis to kind of make it so that now they're priority for us to treat them. And so we get these people on our caseloads that were running around town, weren't interested in mental health treatment, needed treatment for their substance use, and weren't getting the treatment for their substance use because they were connected to us, who was supposed to treat the secondary symptoms of the substance use, but we could never get in touch with them. And they would call us when they were under the influence or when they're out in the middle of the community somewhere, and they wouldn't keep their appointments. And we'd have this kind of like detective chasing down clients by phone. It would take all day, like literally it would take most of the day every day to try to have at least once a week, weekly contact with these people. And, we'd have more and more walking through the door because we'd have these other clinics that were sending them to us. And I'm like, they're not a good fit. Send them somewhere else. Like, they don't even want to be here, you know, and, they're not ready to be here. Like, a lot of them were pre-contemplation stage. Like, they didn't even complete the substance treatment and were leaving the substance treatment and then ended up on our doorstep. Like I'm not trying to say that people don't need help, but it's like they need the right help from the right place, and the clinics can't be bending the rules just so that they get more clients, so they get more money, and having an inappropriate match of clients coming in to the clinic that we couldn't help because none of us were primary substance treatment people. Like, we didn't do that. That's not what we did. That's not what our training was. Like, we knew how to treat it as far as connecting and like collaborating with other sites, but if your primary substance, your needs are going to be different, And so, we didn't run 12-step programs. We didn't do anything like that. And we couldn't enforce it, and that's what they needed. And it was just this uphill battle for a while that led most of us to leave. I think most of us left that year because the situation never got resolved. And a lot of us were just like, you know what, this isn't worth it for me to like stay here and try to deal with this because they're not changing it. And then finally, years later, so this was like in 2020, but years later, in at the end of 2022, once they only barely had like one or two clinical staff and like 600 something clients. And I found out also that most of my clients that I had to put on the wait list because we were low on staff, those clients had been on the wait list for like 2 years. They weren't being seen. And so it's like, I don't know, this is my frustration with these systems. And then I see a lot of programs out in LA because I'm in LA now, and I see a lot of these programs that pay even less than the San Diego programs. And it's not like LA is that much cheaper to live. It's pretty much the same super, you know, expensive cost of living. Um, I think the difference in LA is that you need a decent car and you need to be able to pay for all the gas and the transportation to drive all around, because the driving issue out here is way worse, I think, than in some other places. But yeah, it's just so frustrating. And then most of the interviews I've been getting are for places that I can tell they don't have it together. Staff don't leave places that are paying them well and treating them well and moving them up and, giving them raises and, helping them actually live a relatively comfortable life. If your company is helping you with that, you're not going to leave. There's not going to be staff that are leaving, and you're not going to be completely understaffed on a regular basis. So usually when I see a site that's understaffed, they're hiring for like a whole load of positions, I'm like, either A, you got a contract with more money so you can afford it, or B, everybody left and now you need new people. And I've had a bunch of companies reaching out to me because everybody's leaving, and I'm like, this is not good for mental health. It's not good that the mental health professionals are leaving their their sites. I mean, who's treating all these people? If the professionals can't live off of the wage, I mean, it's really not good. That's really not good. And to have to go into debt, and work for these places for like to get however many hours, and taking these exams that aren't even free, just to get licensed. And, maybe you can work with an easier population then, but it's like, I don't know. It's not working. Um, I hate to knock the field, but it's the frustration of the whole thing why I'm like, I really can't see myself, you know, really trying to long term be a part of that. Um, because when you're a person who actually cares about your clients and you're just like, but I can't live off of this and it's not helping my life, like I can be your nice therapist, but it's like if I'm not getting paid at the end of the day and I'm stressed financially, I can't blow off some steam and go out and like go on trips and do stuff because they're not paying me well enough, and I'm stuck working and working overtime because the system's so inundated. I mean, it's not okay. I don't think there are many other health professions that are so underappreciated. Like nurses, at least they get paid good. You know what I mean? Like, I'm not saying that their jobs aren't stressful, because they are, but they get paid good. You know, doctors, they get paid good. I mean, they have to go through a lot of schooling, but nurses don't have as much schooling, and I don't know any nurses that don't get paid like decently well. from the start, and especially when you have an RN, you know, you when you're a registered nurse, you're getting paid pretty well. Um, licensed people in case management, therapy, social work, they get paid pretty good. Um, I'd say I know a lot of people making about 80, some people making about 70K, which is kind of the minimum you need to live comfortably if you're a single person in Southern California. You can't really make less than that as a household for the most part. Um, but it's a problem. It's a problem, and I feel like a lot of the right people aren't willing to address it, and it's not okay. And I think it's contributing to mental health crisis in our country. It's like, you know, there really can be enough resources for people, but it's just not good. Like, if the staff aren't being treated well, and now I've seen them hiring more bachelor's level, like back when I was starting, you had to have a master's to be working with clients, unless you were like at a desk or like a front desk or something. But you couldn't be having like individual therapy with a bachelor's, unless you were like fully supervised like all times. Like you weren't really going to be trusted to do that kind of stuff. And now they're hiring bachelor's level because they can't get master's level, so they're lowering the requirements, meaning that you have workers that have way less experience, um, way less training, working with the public. And it's a problem, it's a problem. Um, but I don't know. That's my rant for today. I don't really know what else, I don't know how I got on this tangent, but um, it's for those reasons that I don't really feel like I need to go back into working in mental health. Um, as much as I love helping people, I'd rather just talk about it freely on the internet when I feel like it. And then, other than that, I don't really want to be too connected with these companies because I kind of see why it's not working out. And a lot of these places do get government funding. So it's probably the government too. It's trickling down from there that they're not really supporting, you know, like they don't benefit from mental health being helped. They don't benefit from people not being homeless. They don't benefit from people not being sick and in poverty. They don't benefit from that. So why would they fully want to be a part of the healing process? Like they'll give a little bit of money because they have to do something. But it's the same thing with big pharma. Like a lot of these places don't care, because they need that money, um, or want that money for their own greedy reasons. It doesn't help to heal people. Uh, so I don't know. I'm really not interested in being a part of it. But a lot of times, when I'm talking to these companies in these interviews and stuff, I'm like, why do they need so much staff? That's not a good sign that there's so many companies that serve so many clients that need so much staff, and then they're not even willing to pay. Like I've told places I won't take less than like, I should at least be getting $30 an hour, but I'm not going to take less than like 27, 28. And they can't even work with me there. And I'm like, the other site in San Diego offered me like somewhere near 36, and that still wasn't really enough. But I'm like, if they can't even match that, I'm like, you know, you're not gonna get me. Someone with 7 to 9 years of experience, and you want to pay me like peanuts. It's like, come on. But it's just frustrating trying to talk to these places. Because I'm like, really? Like, that's all you're gonna pay? Like, and some of these pay rates are less than what I was already making before. So it's like, why would I want to take that job and be driving all the way like an hour one way in LA traffic or whatever? Like, why would I want to take that job? What's in it for me? What do I get? Benefits, a little bit of savings. Um, I can't move on that amount of money, so there's no point in even considering it. Um, so I don't know, guys. But that's definitely the barriers that come up in mental health. For the people who might not know about it, it's really a problem. It's a true terrible issue, and I don't know what's really being done about it. A lot of these companies are, relying on contracts. Your pay rate is contracted for, so unless the contract changes, they usually don't give raises. And it's just a terrible system. I mean, the only way that our other place got the pay rate up so high was because they had no staff. Everybody left. They had one full time clinician for 600 clients. One. Okay? One. I mean, they had other staff, they had part time staff, temporary staff, but mostly people were going to groups, coming and getting meds, um, contacting case management, but there wasn't that individual therapy. It was mostly just the people who were in crisis got to go to therapy, and the other people were just sticking around on a wait list. So I don't know. It's terrible to do to people. It's terrible. I don't agree with it. I don't think it's good. Um, and it sucks that people are enrolled in one place. They don't know the system. They don't know that they can transfer somewhere else. They don't know that, or maybe they don't want to. You know, a lot of people had a language barrier. So they needed a place that had a lot of Spanish-speaking staff, which we had. Um, but I don't know. I would love to be a part of changing the system and improving it and making it better, but it's really hard to talk to these higher up people. They really don't care. They prey on people's compassion and willingness to use their compassion in their work, and they don't want to pay for it. They don't want to pay people what they're worth. Um, I know what I'm worth because I never had complaints. I only had people who wanted me to work for them. Even these places that I interview with that I know I don't want to work with, they're still calling me like, "Hey, are you sure? Hey, are you sure? If you wanna, if you want a job, we've got a job for you over here. Like, why don't we place you over here instead?" It's like, but the pay, but the pay, but the pay. I'm like a freaking parrot. It's like I will not take that pay. I will not be driving all the way over there. You know, I'm not gonna start at some place that I already know is trying to take advantage. Um, and that's why they're gonna be looking for staff. They're gonna have a hard time finding people who want to stay long term if they're not gonna treat them right. You know, but I don't know if they don't want to hear it. That's kind of up to them. But it's been kind of a long, lengthy rant. I need to get some food in me. Um, but that's kind of where my head is still about the mental health field. And I feel like LA is worse than San Diego as far as the pay rates from what I'm seeing. LA is worse. Um, Maybe just because I know a few places in San Diego that pay more, but I think most county sites in San Diego pay around 30 an hour now. I think a lot of them do because I remember the place I worked at was one of the last places to get a pay rate that was over like 25 or so an hour. And I don't really see that happening in a lot of the clinics that are reaching out over here. There might be some that are paying better, but I feel like those people are probably keeping their jobs and they're not leaving because they know that there's not a lot of opportunity. I guess the opportunity is in getting licensed, but then most licensed people don't want to work with like Medi-Cal and, low income or no income, clinics. Like they don't really want to work there. They want to work with students in universities, or they want to work at places where, people have jobs and money. And I'm not saying that those people are always better off, but there is something to being able to hold a job and, structure your life enough that you can like have a job and pay your bills and stuff. Um, there is something to that way of organizing your own life that is kind of, I mean, those people have something going for them in a way that some of the other people who aren't able to do that ever, some of the other people just kind of don't have, like, they're not well enough yet to really be able to kind of structure things. And I don't know, like, not everybody needs to have like that structured life, but it's like, if it's hard to like keep jobs or stay at jobs or work at all or do anything to get to a place of being able to pay the bills or study or anything. It's like something's going on. Um, usually it's because something's going on. And if it's been like lifelong, usually something's been going on for a really long time. And so a lot of people need a lot of help, but the amount of help that they need, you know, they're not getting it because, the people who are supposed to be working with them don't have the resources to even support their own lives. And so it's really kind of sad. But anyways, I don't want to be like way too much of a downer. Like, I know it's kind of like a heavy topic, but I mean, I know for people who are trying to find mental health support and things like that, like, that's why it's hard to find, clinicians who stay. That's why your therapists are always leaving. That's why, it's hard to get an appointment at a clinic, because half the staff is always taking days off for their own mental health. It's like you can't really, rely on a system that's not really working too well sometimes. Um, but I mean, something's better than nothing, but sometimes there is like a system. This is a system issue that I don't see them changing it too much. LA seems to be in a worse state than San Diego is, honestly. And San Diego barely got it together in like 2022. So um, that's kind of what I've noticed. But for people who are struggling to find that mental health support, that's probably why. Um, it might even be better to see if there's places that pay their staff better, because usually the places that pay their staff better, they're probably going to be, a little more stable with their staff. It'll be easier to probably find appointments, because they're not always going to be understaffed and unable to serve people and unable to get people on the calendar because they've only got like 4 staff and like 1,000 clients. How often are you really going to get seen, right? Um, but yeah, it's definitely a problem. Uh, I'm like in the background thinking of solutions to things, but at the same time, it's like I've kind of moved on with my life into other interests. But all right, I gotta go.